You worked for decades, paid taxes, followed the rules, and now that you've finally retired, you assume the system will take care of you. But here's the truth most people never hear. Some of the most valuable government benefits for retirees don't show up unless you ask for them. And sometimes, not even then, they're buried in paperwork, scattered across different agencies, or so quietly offered that most people don't even know they exist. By the time you hear about them, it's usually too late. Every year, retirees leave thousands of dollars on the table, not because they're careless, but because no one told them what to look for. And the government isn't exactly in a rush to advertise what it owes you. These aren't obscure loopholes or fringe handouts. They're official programs created to help with your housing, healthcare, income, and everyday expenses. But most people never claim them. Either they assume they won't qualify, or they don't even know they're missing out. In this video, we're revealing 8 government programs every retiree overlooks until the moment they need them and realize they're out of time. If you're already retired or getting close, this might be the most important list you see all year. Because when it comes to retirement, you don't get what you deserve, you get what you know how to ask for. It's one of the most overlooked benefits in the entire Medicare system, Medicare Savings Programs, or MSPs. Designed to help low and moderate-income seniors cover their out-of-pocket healthcare costs, these programs can pay for Part B premiums, deductibles, coinsurance, and copays. That's hundreds of dollars a month, thousands per year, straight back into your pocket. But here's the shocking part. Millions of eligible retirees never apply. Not because they don't need the help, but because they don't realize they qualify. Most people hear the word savings program and assume it's only for those in deep financial need. But MSPs have income and asset limits that are higher than most retirees think. In fact, many people who don't qualify for Medicaid still qualify for an MSP. There are several different levels, QMB, SLMB, and QI, each offering different amounts of assistance depending on your income. And yet, because these programs are state-run and poorly promoted, they fly completely under the radar. The worst part? If you don't apply, you don't get it. Even though you might be struggling to pay your Medicare premiums, even if your income has dropped after retirement, the program won't come looking for you. You have to find it, fill out the application, and advocate for yourself. And for every retiree who assumes they're probably not eligible, there's another one quietly saving thousands a year because they simply knew where to look. It's called Extra Help, but don't let the name fool you. This program can save retirees thousands on prescription drug costs, and yet most never realize it exists. Officially known as the low-income subsidy, it's a federal benefit designed to reduce your Medicare Part D expenses. That means lower premiums, smaller deductibles, and deeply reduced copays on medications you may need for the rest of your life. And the savings? They're real. For some, it adds up to more than $5,000 a year. Here's the problem. Extra Help is automatically granted to some retirees, but not everyone. If you don't qualify through Medicaid, SSI, or a Medicare Savings Program, you have to apply separately. And that's where things fall apart. Many retirees assume that signing up for Medicare covers everything, but it doesn't. Part D is a separate plan, and Extra Help is a separate benefit inside that. So, you could be eligible struggling to afford prescriptions and never know that there's a federal program already set up to help you. Even worse, some retirees who technically qualify never apply because they assume their income is too high. But the thresholds are higher than most expect, and they don't count certain assets like your home, car, or burial savings. So, if your medication costs are stretching your budget, don't wait for someone to offer you relief. You have to ask for extra help, literally. If you own your home and you're over 65, there's a good chance you're paying more in property taxes than you need to, sometimes by thousands. Across the country, states quietly offer property tax relief for retirees through rebates, credits, freezes, or deferral programs. But the reason most people miss out? These programs are handled locally, not federally, and the rules change dramatically from one zip code to the next. Some states offer full or partial tax exemptions based on age, income, or disability status. Others freeze your property taxes at the amount you paid when you turn 65. And some allow you to delay payments entirely until the home is sold with no interest charged. These aren't obscure handouts, they're official state policies designed to keep seniors in their homes longer. Yet they often go unclaimed because retirees assume they make too much to qualify, or they don't even know the program exists in their state. Here's the kicker. These benefits usually require annual reapplication, and they're not automatic. That means even if you qualified last year, you could lose the benefit if you forget to file the paperwork. It's one of the simplest ways to reduce your monthly bills, but if no one tells you about it, you'll just keep paying the full amount every year without realizing you could have been saving thousands. If you're a retiree struggling with housing costs or simply feeling isolated, there's a little-known program that could change everything. Section 202, Supportive Housing for the Elderly. Funded by the federal government but administered quietly by local nonprofits, this program offers affordable housing combined with services like meal delivery, housekeeping, and transportation, specifically for low-income seniors. But here's the part no one talks about. Most retirees don't even know it exists until they're in crisis. Section 202 isn't the same as public housing. These aren't crowded complexes or rundown facilities. Many of these units are well-maintained apartment communities tailored for older adults, places designed to promote independent living with built-in support so you don't end up in a nursing home before you need to. Rent is based on your income, typically no more than 30% of what you earn, which can make the difference between living comfortably or constantly falling behind. So, why do so few people take advantage of it? 2 reasons. It's not well publicized and the wait lists can be long. That's why waiting until you need it is the exact reason you might never get it. The smartest retirees start looking early, get on the list, and secure a safety net before their situation changes. Because once your health starts to decline or your budget tightens, it might be too late to get the housing support you could have had all along. If you're retired and still looking for ways to stay active, or just need extra income without draining your savings, there's one government program almost no one talks about, the Senior Community Service Employment Program, or SCSEP. Funded by the Department of Labor, this program pays retirees to work part-time at local nonprofits, schools, and community centers. It's not charity work, it's real income, purpose-driven work, and training rolled into one. Here's how it works. If you're 55 or older and meet income requirements, SCSEP places you in a part-time job, often in places like libraries, food banks, or senior centers, where you earn at least minimum wage, paid for by the program. And while you're working, you're gaining skills, staying connected, and avoiding the isolation that affects so many older adults after they retire. Most people never hear about this program because it's not flashy and it's not widely promoted. But for retirees who want to supplement their income without diving back into full-time work, it can be a lifeline, especially if you're not yet collecting Social Security or need to delay withdrawals from your savings. And since it's capped at 20 hours per week, it gives you structure without pressure. This isn't about working forever, it's about staying engaged and earning on your terms, with help from a program that was built for exactly that. Most retirees think Medicaid only kicks in when you're broke and headed to a nursing home. But that assumption could cost you years of missed support. What most people don't realize is that Medicaid also offers home and community-based services, or HCBS waivers, which can help cover the cost of in-home care, adult day programs, and other supports that let you stay in your home longer and avoid institutional care altogether. Here's the catch. These waivers are limited. Every state runs its own version, and most of them have waiting lists, some of which stretch out for months or even years. That means if you wait until you or a loved one needs care, it might already be too late to get help. The funding is there, the programs exist, but they're not automatic. You have to apply early, plan ahead, and often get on a list before the need becomes urgent. This is especially critical for caregivers who are trying to keep aging parents at home. These waivers can cover things like home health aides, meal services, transportation, and even minor home modifications. But they go untapped because people assume we're not poor enough for Medicaid. The truth is, HCBS is one of the most misunderstood benefits in retirement and one of the most powerful. It's not about where you end up. It's about having the choice to stay where you are. It's not flashy. It's not well known. But it could quietly save you hundreds, sometimes even thousands, every single year. It's called LIHEAP, or the Low Income Home Energy Assistance Program, and it's one of the most underused government benefits for seniors. Funded by the federal government but run at the state level, LIHEAP helps pay your heating and cooling bills, especially during extreme weather months when costs can skyrocket. Here's why retirees miss it. It's seasonal, it's paperwork heavy, and it's not automatically offered. You have to apply through a local agency, and deadlines vary by state. And unlike Social Security or Medicare, this program doesn't send you reminders. If you don't know to ask, or if you miss the short application window, you're simply out of luck until the next cycle. But the benefits are real. LIHEAP doesn't just lower your utility bill, it can also help cover emergency heating repairs, cooling equipment, and even crisis energy support if you're at risk of disconnection. It's especially critical for seniors on fixed incomes, where every dollar counts. And yet, millions of eligible households never apply because they assume it's only for the truly needy. But this isn't charity, it's assistance you're entitled to if your income falls within the guidelines, which are often more generous than you'd think. Don't wait for your next power bill to shock you into action. Check if you qualify before the season changes. It's one of the smallest government benefits out there, but also one of the most frequently missed. When a loved one passes away, the Social Security Administration offers a one-time lump sum death benefit of $255 to the surviving spouse, or in some cases, a dependent child. It's not going to cover funeral costs or change your financial picture, but it's money you're owed. And here's the part most people don't know. You don't get it automatically. You have to request it. During times of grief, paperwork is the last thing on anyone's mind. Families are overwhelmed with funeral arrangements, estate matters, and sudden life changes. The death benefit gets lost in the shuffle. Some assume it's handled when benefits stop. Others believe it's rolled into survivor payments. But in reality, if you don't file for it within a certain time frame, you can lose the opportunity completely. The saddest part? This benefit was originally designed as a gesture of dignity, a small support in a difficult moment. But because it's so rarely explained, and because the government doesn't automatically issue it, countless families never receive it. So, if you've recently lost a spouse, or if you're helping someone who has, don't overlook the detail that most people do. It's a small check, yes, but it's also a reminder. In a system built on red tape, the only benefits you get are the ones you ask for. These programs weren't hidden by accident, but they certainly aren't advertised. And that's the quiet trap so many retirees fall into. You assume that if a benefit matters, someone will tell you about it. That the government, the system, or even your financial advisor will make sure you're getting what you earned. But the truth is far more frustrating. If you don't ask, you don't get. And if you don't know what to ask for, you might never get it at all. Every single program we've covered was built to help people exactly like you, retirees on fixed incomes, caregivers, widows, homeowners, and anyone trying to stretch their savings just a little further. But they're wrapped in red tape, buried in forms, and separated across dozens of agencies. That's not by accident. That's how the system keeps billions of dollars in unclaimed aid every year. So don't let pride, assumptions, or silence cost you what you've already paid for. Whether it's a few $100s or a life-changing benefit, the support is out there, but only for those who go looking. Because in retirement, knowledge isn't just power, it's income, it's housing, it's dignity, and sometimes it's the difference between making it through and thriving.